Hello there. Once again, we're very happy because we're having a very special guest with us. He's been a very powerful tool in the hands of the Lord in Western Africa. I'm talking about the country of Sierra Leone, especially facing the crisis of Ebola. And I'm very glad to introduce to you Mr. Joseph Fobbie,
Yes,
Joseph Fobbie, the business manager at the SDA Medical Hospital in Sierra Leone. Glad to meet you, brother.
Thank you.
It is an honor having you with us in our studios today.
Thank you very much.
Well, could you tell us a bit more about yourself so the viewers could know more about you?
I'm just Joseph Fobbie,
Yeah.
the business manager of Adventist Health System, Waterloo Hospital, Sierra Leone.
All right.
I'm an Adventist.
All right.
I was born an Adventist. My father is a strong Adventist,
All right.
an elder,
All right.
a lecturer, a retired lecturer.
All right.
Yes.
All right. When did you come to be the business manager at the Adventist Hospital in Sierra Leone?
Well, I became the business manager in 2011,
All right.
but I have been working in that institution since 2000 when the hospital was formed.
All right. Now, the hospital was found in 2000.
2000.
Right? So you participated into the building of the hospital, or?
Exactly so.
All right.
I was working for Masanga Leprosy Hospital, the first Adventist hospital in the country.
All right.
The rebel destroyed it.
Where was it? Where was it? In the city?
In
or
the
in
northern part of the
the
country.
northern part of the country?
Yes.
Okay. Then you were working there
Yes.
as the
Administrative assistant.
administrative assistant. So
Yeah.
you versed into the administrative
Yes.
administration
Yes.
of organizations.
Yes.
All right. All right.
Well, it was like my intention was to become an electrician.
Wow.
I did the course, I passed the exam. Few weeks before they can take us to Russia for training, the rebel destroyed, came to Freetown.
Wow.
Yes, and all what we did was in vain. So after the war, I was teaching.
Okay. What were you teaching?
I was teaching in one primary school.
Right.
And that week they promoted me as the bossa.
Right.
That same week, one of our brother in the church came and met me.
Mhm.
You have been chosen to work in one of the Adventist
Wow.
hospital. By then, the war was still on.
Okay.
Where in Masanga, I said, I am not going. He said, you are going, you will work here. God chose me at that time to work for the church.
All right. Circumstances of life.
Yes.
I mean, God was in control beyond the circumstances. He had a plan.
Yes.
And you today, the business manager at the SDA hospital in Waterloo.
Yes.
What is Waterloo, the name of the city, or?
Yeah, no, it's the Western Rural District in the country.
Okay.
Waterloo, well, it is located in Western Rural. It is an historic town.
All right.
Yeah, during the World War, Waterloo was the residence of all the disarmed military officers, ex-combatants, from Nigeria, from Ghana, from here. So it is an historic town.
Yeah, it is. Well, Mr. Joseph, Sierra Leone has been facing a huge crisis recently.
Yes.
Talking about the Ebola crisis. I want you to tell us more about it. First of all, what is Ebola?
Ebola, we are told, is a kind of contagious disease that can spread easily in any form, through sweating, through feces, through the stool, many ways, through touching somebody that has become infected with Ebola.
Well, where is this coming from? How did it come about?
Well, history told us it began in the eastern part of Africa.
The eastern part of Africa?
Yes.
All right. And then?
Well, for many years it has wiped out. It just surfaced in Guinea. We had that. And went to Liberia, came through the border to Sierra Leone, and all of a sudden, people started dying of Ebola.
All over the places.
All over the places.
Well, when was the Ebola problem discovered recently in your country, Sierra Leone?
In March 2014.
March 2014.
Yes.
Now, how did the population face that reality?
It is so pathetic because Ebola wiped out a whole family, many families.
Wow.
And we are deeply affected because the hospital is the only big health institution around the Western area, World District.
The only one?
Only.
Wow.
The other ones we have, the government health center, those are health centers, very small,
Yeah.
and pharmacies.
Yeah.
And we received the heaviest part of the Ebola crisis because the only hospital you can imagine, at that time, it was full to capacity.
Yeah.
We don't know who is Ebola and who is not Ebola.
How
That hospital is serving
Yeah.
over 75,000 inhabitants.
How did you manage?
We have been teaching our staffs about Ebola. When it came in, we don't know. Ebola is a secret weapon.
Oh, that's what they were thinking.
Well, Ebola per se, the slogan is because it's more than the war, because you see your enemy coming with gun to kill you, but Ebola, you don't see it as an enemy.
Subtle.
It came as a friend. And we found ourselves treating our own people, our own brothers and sisters. How can we neglect them when they come to the hospital? So much so that in August 2014,
Right.
we treated the first Ebola patient. We did not know. Ebola came as a symptom of malaria,
Wow.
typhoid, and other diseases.
So you were just thinking it was just some normal...
The first patient came with hiccuping and had fever. The doctor treated him. After the other day, and surveillance officer came, they are looking for this patient. This patient has Ebola. He ran away from a quarantine home. They took him away, and they did the test. They confirmed it is an Ebola. And unbeknown to us, we have been treating Ebola patients.
Right.
Few days later,
Yeah.
the surveillance officer came. They said this man is positive, and we have to quarantine the whole hospital. At first, they told us they will quarantine the nurses that had direct contact with the patient.
Yeah.
And when the surveillance team came, they quarantined the whole hospital.
Wow. Then
You can imagine the scenario
Wow.
at that time.
So you guys were just locked in?
Locked in.
For how long?
42 days.
42 days. So you were also inside?
I was inside, the doctor, everybody.
Wow. How was it like being inside there?
It was scary. Why it was scary, we have the government health center closer to us. And they have been receiving Ebola patients every day. Every hour, people are dying on the street. You see pictures. Even if it is not Ebola, even if you see your mother lying on the street, you cannot touch that person.
Yeah.
Everybody was class Ebola at that time.
By the way, I had a question about the dead people that have been infected with the Ebola, because I heard nobody should touch, right? As you're saying, nobody should touch the bodies. Then how do they handle those bodies? Do they just leave them out there on the ground in the open
Ebola
area?
came, nobody was prepared for it. Even the health officers don't know how to handle Ebola.
Wow.
So there was no method to handle Ebola. That's why plenty of people died.
Lack of information.
Yes. Nobody was trained to that. And even the best doctor we had by then to treat infectious disease died of Ebola.
He died of Ebola?
Yes.
Wow, is he the only one that died from Ebola?
We have
or
about
do you
up
have
to
some
14
staff?
doctors died, and many nurses died of Ebola.
Then, as they were dying, what measures had been taken then?
At first, especially, we lost 2 of our nurses. 3 of them got infected. While we were in quarantine, the doctor every day was taking our temperatures, checking us.
Yeah.
And we found that 3 of them, continuous high fever.
Wow.
They took them to the Ebola treatment center. By then, the Ebola treatment center was far, far away in
Yes.
the eastern part of the country.
Right.
There are many stages before they take you to the treatment center. They will take you to one center, the government central hospital.
Yeah.
They test you.
Yeah.
They take you another center. By the time you go to the treatment center, it is worsened. Many people died.
Wow.
It was later they decided to build different treatment centers all over the country.
All
By
right.
then it was only 2
Wow.
treatment centers in the country.
All right. Now, when you were in quarantine, what were the thoughts that you were having as a person? What were you thinking about all the time?
As a business manager, you can imagine, by then I have lots of responsibilities to
Yeah.
take care of our staffs,
Yeah.
to take care of their families out there.
Yeah.
I was the center of communication.
Yeah.
They want to know about their people, their brother and sister, their wives, their children.
Yeah.
At the same time, we were worried about them out, that they too cannot get contracted.
Sure.
We cannot go closer to our families. We have our workers crying on us every day. Especially when 2 of our staff died and they told us we should have closed this hospital. You have brought us, the administration,
Yeah.
who have brought us up to this point, and we say we are missionaries.
Yeah.
We owe allegiance to the government,
Yeah.
to the community,
Mm-hmm.
to the church.
Yeah.
None of those institutions told us to close. We are here to save lives. We are like the soldiers,
Yeah.
the military, going to fight war. They have to face the realities. The hospital is like a soldier again, fighting Ebola. If all of us run away, who can fight Ebola?
How many of you did
44 in quarantine.
44?
Yes.
And how many of those 44 were thinking the way you're thinking?
Many of them.
Many of them.
Only 2 of us, me and the medical director,
Yeah.
we had that burden, but we are able to talk to them.
Okay.
We have our chaplaincy every morning. We will conduct our morning devotion. We will
Yeah.
preach to them. By them, I was lucky that I still have my modem.
Yeah.
I communicate out to other people
Yeah.
to tell them the reality, because when these government people quarantine us, they don't give us enough food, and we are not to go outside. We don't have enough clothing to change. We put on what we had by then for the 41 days.
Wow.
And they came in with all the military and police officers to make sure we don't move.
All right.
It was later, we have been treating people. That hospital gained recognition many times past with our expatriate doctors that came.
Yeah.
And the doctor we have is a good doctor. So people started sending food everywhere for us. We can sustain ourselves
Praise God.
whilst we were in quarantine.
Praise God. So
And the
Lord-
staff
Yeah.
later took courage.
Yeah. Yeah.
We spent 42 days, as I said before. After the 10 days, they took courage. And by then we were having some paint and other things. We are hoping to, when they release us to continue the work,
Yeah.
they got that motivation. So we painted the hospital whilst
Yeah.
we were in quarantine,
Yeah.
hoping that the government will allow us to continue.
Yeah.
By then we know now we have got the know-how. We have been teaching them to tackle Ebola, because whatever happened out there, those people are our people,
Yeah.
our families, our brothers and sisters. We need to join the fight against Ebola.
Right.
After we are released from quarantine,
Yeah.
we told government we want to run, and the government said no. We want to protect you, we want to protect the nation. Many more people will continue to die. Yet still by then, there was not laid down protocol. And they said, well, this is an ideal place. We will use this as an Ebola center.
Wow.
Straight away, they called us, the church.
Yeah.
We went to the ministry. We sat with all the health officers.
Yeah.
They begged us. We had no choice. We gave the hospital away because we want to fight Ebola. And we called the union,
Yeah.
they agreed. The union called the division, they agreed. And they started construction. There are some good parts of it.
Yeah, true.
Many years passed,
Yeah.
we have been fighting for recognition, for government support.
Yeah.
No one was listening to us. Now they know us.
Yeah.
They knew what we have done to fight against Ebola. They brought solar lighting system in the whole compound, in the wards. There is a building we are putting on, a pediatric wing.
All right.
Within us locally, we sought out for funding.
Yeah.
We saw the need,
Right.
and we went to some organization, especially Mission Direct,
Right.
a UK-based organization. They have been very helpful to us in many areas.
Yeah.
So that building was under construction to roof height. The government did many things on it
Yeah.
to be used as an Ebola center. They brought in generators, other supplies.
All of this was coming from your faith at a primary stage,
Yes.
your belief.
Mm-hmm.
Have you, I mean, there's some good to it as well, as you were saying.
Mm-hmm.
Have you been, I mean, I'm sure you're thinking that you're a miracle. You are a miracle, by the way.
Yes.
And all of these other people that, came out safe out of the, the whole Ebola scenario.
Yes.
And the whole issue that was going there. Were you guys afraid to die?
It came a time we are no more afraid to die. Everybody is afraid to die.
Yeah.
But when the reality came, we have to face it.
Yeah. Can you say that the fact that you believe in God made you have a different perspective when it came to facing Ebola?
Yes. Our mission is to provide good health care service to the communities.
All right.
And this was a challenge.
All right.
It has come. What can we do? We have to end it. So we took the challenge to be on the forefront to fight Ebola.
Very good. Well, Mr. Joseph, I wanted to ask you, for our people that are watching us, what are the measures that people can take in order to avoid, people in general, what are the measures that people can take in order to avoid being contaminated?
There are many
the Ebola?
measures. I told you, Ebola is a contagious disease. Hand washing, frequent hand washing.
Frequent hand
It's
washing.
a good procedure. And avoid body contact. It's a good procedure. And, well, you should not touch dead bodies, the corpse. It is our tradition whenever somebody dies.
Yeah.
We need to play with that person. We need to wash that person. Many a times, even inside the casket, we kiss
Yeah.
our relatives, our loved ones.
True.
But we are prohibited this time because of Ebola.
Yeah.
We should not do that.
All right.
We preach about Ebola throughout different medium.
I heard about the handshaking. We can't shake hands as well?
We should not,
We
for
should
now,
not.
in Sierra Leone, Liberia, and Guinea. We should not shake hands at all.
Wow.
Because if somebody is infected and they have started showing these signs, and seems like if you touch that person, you can easily get Ebola.
So you don't know who is who.
You can't tell.
So you rather be careful. Prevention is better than care, as one would say.
Ebola is more than fighting with your enemy with gun. You can see your enemy coming. You can hear the gun sound, whatever weapon. But Ebola, you don't hear the sound.
Have you ever been in a scenario where one family member is affected by the Ebola and the other family members would be treating that person in a special way? Have you ever?
We had
been into
plenty,
that?
not one of them. We have, in my list of survivors, even those that survive from our centers, we have a list of family. Maybe only one or two survived.
Now, when one person from a family is infected by the Ebola, how do the others handle that person?
You just have to treat your brother and sister. You have to hold that person, you have to give medication, you have to take that person to the toilet, you have to wash that person.
But how can you do that while you have to avoid physical contact?
Well, that's why many people died at the beginning. Because when people know exactly now, this person, whether malaria or no malaria, you cannot touch. Normally, you leave that person to die. And you call the authorities that are responsible, the response center. By then, they will not come. Some people will lie there for 2 days.
Yeah.
The time Ebola started, we have only few ambulances in the country, few medical staff. We are ready to work after others have died.
Well, have you got some lessons?
Plenty.
What lessons have you got? Can you
One,
share with us?
I can tell you the commitment of Sierra Leoneans to fight against Ebola was so great. The time the government came to use the center as an Ebola center, when they came, we thought we would not get people to work. In fact, we had time rejecting other people when it came to work at the center. People came from everywhere, volunteer to work, to fight against Ebola. Everywhere. We started the work. Interesting scenario. Everybody was eager to work. The day the first Ebola came, December 17.
December 17.
People were afraid to go and see the first Ebola patient to treat. We had to cajole them. And when they started treating them, it was like a miracle. What I can testify now to you, all other centers in the country, each centers, when they started treating Ebola, 2 or 3 medical staff got infected. Some of them died. But for the Adventist Hospital Ebola Treatment Center, nobody got infected.
From the time you started?
We started treating Ebola patients.
So all of you guys are still alive?
Yes, we are safe.
Praise God.
Thank God for that.
What will be your message that you'll have for the viewers right now, especially the Africa viewers?
Well, Ebola is here and it is still there. We have gone few days. We have discharged the last patient. We have gone days without Ebola, but we should not be complacent. Even all over Africa, we should still go with the strict measures, all the ABCs, to avoid Ebola. And we need support in that part of the world. In many areas of health-related problems. We need help from our African brothers and sisters. We need support, especially the Adventist Hospital Waterloo. It is the only Adventist hospital. It is in a strategic location. It is located in a place connecting all other parts of the country, connecting all over the provinces. We have a vast land for development. That area, the government is constructing now the airfield. The government is expanding the roads. Mining companies are there. Expatriates are going there. And that is the only hospital.
A lot of activities there.
So we need to improve that hospital.
Now, where could our viewers send donations if they are willing to help you?
They can go to AHI.
AHI. What is AHI?
Health International. They can go to Loma Linda Adventist Institution.
So they get in contact with?
Yes, they can contact the church.
All right.
For Waterloo Hospital for now.
All right, all right. Well, it was really great having you with us. It was such a blessing. You sharing your history, the history of your hospital, and especially with the Ebola crisis. Yeah, you've been through a lot. Our time is very short. We can't talk about everything.
Yes.
I know you have
one
a lot.
last point we want to say. We want to thank Adventist Health International. We want to thank Dr. Kidi We want to thank Dr. Hart for supporting us during this time. It is a self-sustainable institution. During the Ebola, we cannot generate funds.
Talking about the AHI?
Yes.
Oh, yeah.
They paid our salaries up to this point.
Oh, so they really supported.
Yes, we have started disinfecting the hospital. Hopefully the government will give us the authority to run the hospital again. We are hoping to start again to run the hospital. We need support. We need volunteers. Volunteers has been coming to the center.
Okay.
And we want them to continue to come from everywhere in the world.
All right.
For every discipline, we need them to come and support.
So the call is made. If you are interested in supporting the Waterloo Hospital, Waterloo SDA Hospital in Sierra Leone, you are free to contact the Loma Linda University. If you want to volunteer, you are free to come because they need your help, especially with the Ebola crisis. Well, thank you so much, Mr. Joseph.
Thank you very much.
Yeah, business manager at the SDA Hospital in Waterloo, Sierra Leone, and we hope to see you sometime.
Thank you, Hope Channel.
Yeah, thank you. Thank you for watching. It was my pleasure to have this conversation with business manager Joseph Fobbie at the Sierra Leone SDA Hospital. I'll leave you for now. Take care. God bless you. Bye.